You're listening to the Assembly on Sleep and Respiratory Neurobiology podcast, brought to you by the American Thoracic Society.
Welcome, everyone. My name is Helena Schotland. I am at the Icahn School of Medicine at Mount Sinai. I am the co-web director for Sleep and Respiratory Neurobiology, and today I have the pleasure of introducing my colleague, Refika Ersu, at the Children's Hospital of Eastern Ontario. Refika is the web director for ATS Sleep and Respiratory Neurobiology. Today, we're going to be giving you a preview of some of the exciting sleep content at the upcoming international conference in San Francisco. Refika, what are some of the things that are going to be interesting you for this meeting?
So thank you so much, Helena, for this nice introduction. And it's been an absolute pleasure to work with you and the rest of the group on SRN activities this year. So there are a lot of exciting contexts in the pediatric sleep this year. And one of them is during this very exciting PG course on Friday, May 16th. It's called Advances in the Management of Complex Sleep Disorder, Breathing, and Chronic Respiratory Failure. It has a skills-based section with small group hands-on learning opportunity, which I always find very useful for clinical practice. And it will include diaphragm ultrasound, high-flow nasal cannula use, download interpretation, and mouthpiece ventilation. So people usually have a lot of questions about those in practice because in theory you read a lot about them. So I'm very excited about this PG course. How about you, Helena? Any PG courses that you'll be attending?
Yeah, so on Saturday, the 17th, I'm actually lucky enough to be one of the co-chairs of this postgrad course, and this one is entitled Tackling Obesity in Patients with Sleep-Disordered Breathing. And as all the sleep folks know, this is a very hot topic right now. Lots of interest, lots of activity, and this course is going to focus on the advances in the management of obesity for adults with sleep-disordered breathing. So there are going to be lots of great speakers talking about bariatric endoscopy, surgical interventions, of course, GLP-1 agonists and beyond. And there's going to be lots of great content. So that's something that I hope that people will attend. On Sunday, Refika, what are you going to do?
Yeah, so on Sunday, there's an exciting scientific symposium, and it's about advances in pediatric OSA through Down syndrome focused trials. And this is very important because obstructive sleep apnea is very common in children with Down syndrome, adolescents and adults alike. And there are very significant consequences. And if you diagnose and treat them timely, it will improve cardiovascular and neurocognitive outcomes. But it's very challenging to both diagnose and to treat. So this symposium will tackle these issues and will include discussions on treatments with even medications, which is of course, a dream to treat obstructive sleep apnea with a pill. So I'm really looking forward to that one. And on Sunday, there's another exciting symposium, and that will be on disease-modifying therapies in pediatric pulmonology, and will include the impact of new treatments, the disease-modifying treatments in children and youth with spinal muscular atrophy and Duchenne muscular dystrophy. So these treatments have really changed the course of disease in these, especially in SMA. So it will be exciting to hear about the new trials and the clinical experience on this. So how about Monday, Helena? What are you attending?
So to keep on track with the weight theme, there is a scientific symposium in the afternoon entitled Therapeutic Innovations for Weight Management in OSA, from Metabolic Modulation to Weight Loss. And this session is going to look at some of the latest research on pharmacotherapeutics for metabolic modulation and obesity management in OSA, and they will review the breadth of physiology linking these two conditions. So that's going to be another very important session on weight. How about Monday?
So on Monday at 2:15 p.m., there's a scientific symposium on sleep and sudden death. So this is pretty much something that pediatrics really does not focus on because we're fortunate that we don't see that a lot. But when it happens, of course, it is a very impactful on the whole team as much as, of course, the family. And this will discuss the mechanisms of sudden death in sleep, in congenital central hypoventilation syndrome, in sudden infant death syndrome, as well as sleep apnea. So I think this is something that I'm really looking forward to joining, because I think it will make us think about the mechanisms of these disorders and how we can prevent this disastrous outcome in pediatrics. And a shout out to Dr. Thomas Keynes, who previously received an SRN award and whom we have interviewed for the Sleep Pioneers, will be chairing this. I'm really looking forward to his thoughts on those talks as well. And on Tuesday, Wednesday, any SRN activities, Helena?
Yeah, so there's some great content on Tuesday. One of the popular sessions is the adult sleep clinical core curriculum, and that's Tuesday afternoon, 2:15 to 3:45. And some of the talks there are going to be on sleep and aging, sleep and menopause, and sleep and disadvantaged populations. So those core curriculums are always great sessions. And then the following day, Wednesday, the last day of the meeting, we have a scientific symposium in the morning, 11 a.m. to 12:30 p.m. And this one's a little bit different. This is strategies to improve patient-centeredness and diversity in clinical trials of OSA care. And this session will look at state-of-the-art reviews and have an in-depth panel discussion. Both trialists and patients will review strategies to design randomized trials, particularly with patients in mind. So that sounds like a really interesting one as well. And there's a lot of other great content during the meeting. Poster discussions, other interesting sessions. So everyone should take a look at the program and pick and choose what is interesting to them. But I think it's going to be a fantastic meeting. What other activities do you think we should attend, Refika?
So it's always exciting to attend the Sleep and Respiratory Neurobiology membership meeting. And this year it will be on Monday, May 19th from 5 to 7 p.m. And it's in the West Building Level 2, room 2001, 2003. If you have interest in the SRN assembly, we would really encourage you to join. It will review the activities that has been done over the last year and what's to come. And it's a really good opportunity to network and get involved in the activities. It's a very welcoming environment. I've been working with this group for many years now, and it has been very fruitful. I learned a lot, not only for science, but also networking, build friendships, and a lot of mentors for young people out there. And there is an Aspire Fellowship reception that will follow. And this is really also a further opportunity to meet all these people who have done so much work in our field. And that's right after the membership meeting from 7 to 9. And I think it's just across the room in West Lobby, level 2, in the conference center. And I will remind you that we'll have an award ceremony also during the membership meeting that will, our assembly will honor one of the pillars in sleep medicine. So we are really very excited to attend the conference, learn lots, but also meet our colleagues and friends now that we've been seeing them for many, many years and became friends, and really welcome you to the SRN assembly, which is a welcoming, very scientific, very friendly environment. And looking forward to see you all.
Take care. See you all in San Francisco.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more podcasts from the ATS assemblies on YouTube. Don't forget to like, comment, and subscribe so you never miss a show.